Please know we recognize you for your dedicated work. Today, we wish to let everyone know that it is possible to benefit from the health advantages that can be ours if we stop carbon pollution in all its forms, embrace clean energy and clean transportation, and regenerate our soils, prairies, wetlands, and forests. Our long-awaited opportunity seemed to have arrived with the election of a president and a Congress that are committed to climate progress. In response to the election, the consortium and partner organizations made recommendations to government at every level: executive leadership, regulatory agencies, legislative bodies, and even the courts. We pushed for and were delighted to see an Office of Climate Change and Health Equity established within the U.S. Department of Health and Human Services. During the last year, we invested serious effort to unlock the potential for progress at the national and state levels, with the result that at this time, many things are happening and much is in process. Our vision has not dimmed. Today, as we gather for our 5th annual meeting, the Bipartisan Infrastructure Law of 2021 presents meaningful opportunities this year for states to use the funding for improvements that bring climate progress. The involvement of advocates who are willing to learn and collaborate with others is key. The climate investments that were part of the larger Build Back Better package of legislation have not passed, but some still can. In 2021, the climate and health movement was more of a focus than ever before at COP26. The US Secretary for Health went to COP26 and announced that the US health system would decarbonize. Thanks to the investment of time from our affiliate Healthcare Without Harm and some of our longest time advisors, the National Academy of Medicine lifted the banner of decarbonization of the health system. With the collaboration of HHS and the Assistant Secretary for Health, who you will hear from in a bit, this work is starting to bear fruit. I'd like to stop now and introduce my colleague, Dr. Ed Maybach, the Director of the Center for Climate Change Communication.
Thank you, Mona, and good morning, everybody. Welcome. I'm just going to spend a couple of moments to try to give you the 60,000-foot overview as I see it about the importance of our work. Colin, if you could go forward, please. Over the past 15 years, I'm a career public health professional, finished my 4th decade at it recently, but over the past 15 years, I've focused on nothing but the human health implications of climate change, because I've become convinced that this is the public health issue of our time. And this, limiting the warming of the planet to no more than 2 degrees, ideally no more than 1.5 degrees, really is the public health goal of our era. Next, Colin. And but it's a big goal. It's an incredibly important goal. It's a goal that if we do not achieve it, we will be failing our children, our grandchildren, and their grandchildren. But we do have an incredibly potent tool in waging the effort to try to achieve that goal. And that potent tool is our trusted voices and the simple, clear messages that we have the opportunity and are continually creating the opportunity to repeat through our variety of trusted voices. Again, in my four decades of work as a public health communication professional, I've become absolutely convinced this is our most potent tool in waging public health campaigns. Every public health communication campaign in human history, and probably every campaign of any type in human history that has prevailed on the basis of this formula. Next slide, please. Our theory of change in the Medical Society Consortium is really pretty devilishly simple. We our view of how we're going to do our part in the U.S. to achieve that goal is that when we use our trusted voices to engage the public and to engage policymakers, we create public will and we create political will for equitable climate and health solutions. This is it. It's not more complicated than that. What isn't shown on this slide, however, is an incredibly important other aspect of the current situation, and that is we are not working in absence of opposition. The opposition is not shown on this slide, but the opposition, I'll just call them out: fossil fuel lobbyists and their PR flacks and their disinformation machine. They have had a wrench in the works, pretty securely in the works for the past 5 decades. Our task is to use our trusted voices with sufficient reach and frequency and persistence to try to get that wrench out of the works so that there will be adequate public will and growing political will, so adequate or necessary to achieve political solutions. Next slide, please. I'm happy to say that we're making progress. We are absolutely unequivocally making progress. Part of the work that we conduct in the Center for Climate Change Communication is a national public opinion poll. Every 6 months since 2008, we've polled the public. We call those surveys the Climate Change in the American Mind poll. And in the very first survey in 2008, we identified 6 distinct groups of Americans with regard to their views of climate change. We call them Global Warming 6 Americas. In 2009, when we published our first findings, the alarmed group on the left and the dismissive group on the right were the same size. They were both 12% of the populace. As you can see, 6 years ago, when we first launched the consortium, the alarmed had already grown to 18% of the population. The concerned, a group that felt like them, but not quite as strongly, 34%. The cautious, who understood perfectly well that climate change is a reality, 23%. And if you just look at those 3 groups, you can see that's the vast majority of Americans, even 6 years ago. But now go forward to the bottom of the slide. Today, Global Warming 6 Americas in fall of 2021, you can see there's been an enormous growth in the proportion of Americans who are alarmed. These are people who, like probably every one of us in this meeting, we're convinced that human-caused climate change is a reality. We're really worried about it. We're rolling up our sleeves to try to get involved, and we are fully supportive of a muscular policy response to try to rise to the challenge of this problem. Next slide, please. With regard to public understanding of the human health consequences, the human health relevance of climate change, which is what we are all about. Unfortunately, I showed you the same slide last year. I don't have more current data, but it's a slide worth looking at again, because you can see between 2014 and 2020, there was a huge increase in public understanding that all of the fact-based impacts of climate change are becoming more frequent in communities across America. So 7 years ago, only about a quarter to a third of Americans understood that health harms were accruing in their community, and now it's over half. That is a major change in public understanding in a very short period of time. Next slide, please. Rob Gould, a little later today, Rob Gould's going to take you through a much deeper look at what we've learned based on our communication research about how to message effectively about climate change and human health. But our research shows us really clearly, not just our social science, our communication research, but also the climate science research and the epidemiologic research, that there are 5 key truths about global warming. And those 5 key truths are not complicated. They can be expressed in 10 words. It's real. Global warming is happening. It's us. Human activity is the main cause. Experts agree. More than 99% of the world's climate experts are convinced, based on evidence, not on ideology, that human activity is warming the planet, that it's bad. It's not just bad for plants, penguins, and polar bears, but the impacts are serious and they affect people, especially our children, our elderly, people with chronic illnesses, members of low-income and communities of color, and others. And finally, and perhaps most importantly, there's hope. There are so many things that we can do that will both address climate change and improve our health in equitable ways. The opportunities are profound. They're right there for our taking, and that's what the consortium is all about. Next slide, please. I want to close with a very brief story. It's the story that gets me out of bed every morning. It's the story that keeps me working diligently all day long. And it's the story of 7 American and Soviet physicians who in 1980 established the International Physicians for the Prevention of Nuclear War. In 1987, their message was incredibly simple. Their message is that nuclear war would destroy destroy civilization and might extinguish human life. By 1987, when Mr. Reagan and Mr. Gorbachev signed the nuclear test ban treaty, that we knew that the trusted voices of health professionals could have a profound influence on political processes worldwide. It's nice, but perhaps less important than the test ban treaty itself, that in 1985, IPPNW actually won the Nobel Peace Prize for their work. If we go to the next slide, we can actually see, no matter what I say about it, we can actually see what Mikhail Gorbachev said about it, because that's what's really important. He was one of the two people who ratified that test ban treaty. In his autobiography in '87, titled Perestroika, he said, their work commands great respect. For what they say, what they, i.e. health professionals, say, and what they do is prompted by accurate knowledge and a passionate desire to warn humanity about the dangers looming over it. In light of their arguments and the strictly scientific data they possess, there seems to be no room left for politicking, and no serious politician has the right to disregard their conclusions. 5 years later, he actually sent the executive director of IPPNW a thank you note. And he said, I want to thank you for your great contribution to preventing nuclear war. A thank you which could not be possibly more relevant today. Without it, and without other effective anti-nuclear initiatives, this treaty would probably have been impossible. Final slide, please, Colin. Just want to leave you. I'm also inspired by the the words that Margaret Mead may or may not have offered up many decades ago. I've changed them up for my own purposes, but I leave you with this thought: never doubt that simple, clear messages repeated often by a variety of trusted health voices can change the world. That, my friends, is what we are all about. Mona, I pass the microphone back to you.